going to insert a catheter on our female patient who needs a Foley catheter because she's unable to urinate. And the first thing we're going to do is raise the bed to a safe working height, typically waist level. Sometimes I do it a little bit lower than waist level because the knees get in the way when you position them. You're going to explain to the patient, Mrs. Smith, that they're going to insert a catheter and you're going to feel some pressure. The first thing you're going to do assessment-wise, you're going to palpate her abdomen and bladder to make sure she has a full bladder. I'm looking at you. Hold on. You also need to do period care, which you already know how to do. And typically we want urine output for 30 mils an hour when we have a Foley catheter. If it's less than 30 mils an hour in a 2-hour time period, we need to notify the physician. Also, when patients that need Foley catheters, they need to be critically ill and like in the ICU. They also may have skin breakdown in their peri area or their rectum, their coccyx. So having a pressure ulcer qualifies you for catheters. We don't put catheters in somebody just because they're incontinent. So you have to have a reason. If a patient complains of urinary frequency, you don't want to just put a catheter in them. So we're going to put them into position. You're going to perform your period care that you've already learned. And you're going to put them in dorsal recumbent. You're also going to provide a blanket at the top. And you're going to tell the patient that you're going to provide privacy and expose their legs as needed. So I'm not going to put the blanket up very high, but you can put it up as high as you need to. And you're going to check your kit and make sure there's no water damage. This says it's a 16 French catheter with a 10 ml balloon. It's silicone, so it's latex free. Oh, this says it is a latex catheter, but some of them just are silicone. Some people like to use this as their trash bag when you're doing your checkoff, so just put it at the end of the bed. And you're going to open the kit away from you, side, and side. And you need to remember your 1-inch border. Just gonna grab that. And then you're going to come over here. And we've, just want to make sure I'm not missing anything here. Sometimes if they're a larger patient, you might need a light to help visualize. Okay, so I'm going to apply my sterile gloves with your dominant hand first, and then your non-dominant hand. And if you have really large hands, you might have to use a different size glove. So then this comes prepackaged. It's a towel. You're going to kind of tuck your hands underneath so you're not touching the patient and slide it under their bottom. Then you're also going to take this towel, it's a diamond shape, and lay it over the opening. And then I like to take my kit and lay it side by side. It comes with betadine, 3 swabs. I like to go ahead and open this while I'm standing over here. Drop that in the trash. I like to open my lubricating jelly. And then I like to go ahead while I'm here. Make sure when you take this out of the package you don't let it fling around. That's bad. Don't do that. And you're going to take your syringe. I like to attach it before I move it over. Okay. And actually, this is all sterile because it's all still in the package and it's not touched anything non-sterile. So you're going to take this. I like to grab my whole thing and drop it onto my sterile field and then move this up. So this is sterile. You know you have a 1-inch border. I like to take this out nice and slowly, not letting it fling around. Drop that out of the way. And I'm going to lay this in my sterile field into my thing. And you're going to take your non-dominant hand And you're going to spread the labia open all the way. Lucky for us, Mrs. Smith's labia is wide open. You're going to swipe. Oh, I just touched my sterile field, which is fine because it's still in the sterile part. This, my left hand or my non-dominant hand is considered my dirty hand because it's holding open the labia. You're going to swipe one time down on the, not on the farthest side away from you. Discard. You're going to take your other stick. Keep it in your left hand so it doesn't move. If it moves, the labia closes. I just moved it, but don't move it. Swipe down on the inside closest to you. Discard that stick. And then your third stick, you're going to go straight down the middle. Don't put the betadine on the mannequins because I have to go around and clean them, but you get the general concept that you would touch the skin all the way. As we tell Mrs. Smith, you're going to tell her to bear down as you insert it into the urethra and not the vagina. So you say, Mrs. Smith, take a deep breath. You're going to insert it as far as you can. You're going to be able to see urine. And hers isn't going very far, but just pretend it is. And you want to go to the Y port, okay? And you're going to inflate your balloon. And it comes 10 ml French. It tells you 16 French, 5 to 10 ml balloon. And you're going to discard your syringe. As urine is draining, you're going to be like, oh, good job, Mrs. Smith. And you're going to take this away. And you're done with your sterile technique. If she has extra betadine, you can get a washcloth and wash the extra betadine and lubricating jelly away. And then you're going to discard all of your trash. This kit does not come with a leg securement device, but some of them do. And you would just tape it gently to the leg, on the upper leg. If it's a male, you want the upper thigh or the lower abdomen. But on the female, you want it on the leg. Oh, I'm getting betadine on my sheets. I'll have to wash that sheet. Tape that. Mrs. Smith, you did a great job. You can relax your legs. And hang it onto the bedside table. Onto the bedside. To the bed. You want to keep the catheter back below the level of the bladder. If Mrs. Smith oh, don't rub your eye after you take your gloves off. Take your gloves off, then perform hand hygiene. Perform more hand hygiene after you throw the trash away. Mrs. Smith says she's doing great. She likes having the catheter. It's draining nice, clear, yellow urine. You would document how she tolerated the procedure. If she complained of any pain or discomfort, let your physician know. Oh, I know what I was going to say. If you inserted it into the vagina instead of the urethra, leave that catheter there and go get a brand new kit to start all over with. So you're not inserting it into the same place. Okay? If you have questions about this, please stop by and see me.